I'm Lucy Beednell with the ARC of Northern Virginia. This 3-minute webinar will look at ways to navigate the waiting list for the developmental disability waivers in Virginia. As of 2016, Virginia has 3 developmental disability waivers and they share a common waiting list. Time on that waiting list is really challenging to predict because it's based upon the urgency of need of people waiting for services, and that urgency of need is constantly in flux. That's why if you're on the waiting list, it's critical to make sure you're in regular communication with your local Community Services Board, or CSB, to update them on anything in your life or the life of the person with a disability that may affect your status on the waiting list. Whenever new waiver slots are funded by our State General Assembly, a volunteer waiver slot assignment committee meets and reviews people most urgently in need on the waiting list and makes recommendations on who will receive the waiver services. All year round, there should be emergency or reserved waiver slots that can be accessed immediately for true emergency cases, which the state defines as adult or child protective services involvement that is mandating new services, and or when the primary caregiver or caregivers have passed away and the person with a disability needs immediate help to care for themselves. Anyone on the waiting list is put in one of 3 tiers. Priority 1 is what the state defines as people who need waiver services within a year, though that is no guarantee of service time. Priority 1 individuals either have an urgent need themselves, for example, a medical or behavioral need that is not being well supported, or have caregivers who are not able to best provide for their needs. For example, a caregiver who is battling cancer or has other complications in their life would make it challenging to put the time and energy and effort into caring to the person with a disability in the best way possible. About a quarter of our waiting list is on the Priority 1 status. Priority 2 is for people who need services in 1 to 5 years. Again, not a guarantee of service time. And Priority 3 is for individuals who may not need services for over 5 years, people who are generally young, generally healthy, and generally have low needs. If you are on the waiting list, you may be able to apply for services through the CCC Plus waiver, one of Virginia's other waivers. You can see our separate 3-minute webinar on that. That waiver is for people who also have medical needs in addition to their developmental disability. If you're on the waiting list, you can apply for the Individual and Family Support Program, which is up to $1,000 a year in grant-style funding for supports related to your disability. You can also access crisis response services for adults and for children. Learn more from the ARC of Northern Virginia at our website, thearcofnova.org. Ask us a question anytime at thearcofnova.org/answers, and visit our Transition Points page, which has information and toolkits for people with a developmental disability across a lifespan. Thanks for joining us.